On this program, a special conversation with Michael Botticelli. He's director of the White House Office of National Drug Control Policy. Director Botticelli was confirmed for that position in a favorable 92-0 vote by the United States Senate, and he's formerly the Director of Substance Abuse Services for the state of Massachusetts. Is it fair to say that alcoholism and drug abuse, number one health problem in America? Is that a fair?
I think it's a fair, not only health concern, but economic concern for this country. I think that we know kind of untreated addiction has major repercussions in terms of not only healthcare costs, but certainly criminal costs, lost productivity. So we know that there is significant, not only health concerns, but economic concerns as it relates to untreated issues around substance use.
Alcohol, we know, alcohol is alcohol, but when we talk about drug abuse, drug addiction, what are the kind of drugs we're talking about?
So for our office, and even though particularly when we focus on youth, we know we're talking about all substances. But you know, when we look at adults, we're talking around marijuana, cocaine. Certainly of greatest concern for us these days has been around prescription drugs and heroin. Those are two big issues that are reaching epidemic proportions in the United States. So you know, those are kind of some of the major drugs that we track in terms of looking at how are we doing in terms of our national policy.
You put the opioid addiction on the table, and let's wander there for a second. This is a tough question to ask, but when you talk about opioids, which is medication for pain, right? And then you talk about heroin in the same sentence, I guess. Is it because the media was focused in on these overdoses that keep happening? 23,000 deaths from overdose. Did the media catch on and it moved from inner city to the suburbs, from older people to younger people?
I think part of what's really kind of captured people's attention, and rightly so, has been the significant addiction and mortality associated with both of these opioids, both prescription painkillers and heroin. You know, in 2012, you know, we had 120 people dying every single day of an overdose in the United States, greater than traffic fatalities. So, you know, from a public health standpoint, you know, one doesn't have to look very far to look at the magnitude of the epidemic. And I think to some extent, because of some of the changing demographic of who's been affected, I think that's gotten people engaged in this issue who historically haven't seen addiction as part of their concern. So you know, addiction can be a disease of denial, and I think that denial can exist not only at the family level, but at the community level as well. And I think that what this has shown is that addiction doesn't know geographic boundaries, it doesn't know socioeconomic boundaries, that all of us are vulnerable to some of the issues that we're seeing. So I think that what it has done is really kind of engaged people and kind of broken through some of that denial that this is not an issue for other families or other communities, but that this is our concern as well.
But you know, we both came up with alcoholism in the family tree, but everybody's got some kind of addiction in the family tree. Why is that kind of universal country denial so much in place? Because it's all around us.
I think we're breaking through that. I think we're breaking through that, and I think we're breaking through that in a number of different ways.
Go ahead.
I think certainly the opioid epidemic, and when you look at, and you know, I travel all across this country, and this is very personal for a lot of people that they know someone, and again, I think, you know, even though, you know, addiction to alcohol and others has cost us dearly as a country, I think that because we're seeing younger people affected, I think we're seeing people in rural parts of the country, that it's, I think, really awaken people to the fact of that addiction affects just about every family in America. And so, so I think that we're kind of finally breaking through that. I think the other piece on a positive note, too, is that we are coming to the realization that there are about 20 million people who are in recovery in the United States, and
20 million.
Estimated 20 million,
Okay.
and for a variety of reasons. Some of that is founded in some of the anonymity of our 12-step programs, but that this is a community that's awakening. And so I think that people are seeing that and celebrating recovery, that we know it's possible. We have these great treatments now, and we know treatment's effective. So I think it's twofold. One, the magnitude of the problem, but I think second of all, the establishment of recovery as part of people in the community. So I'm really optimistic that we can really change the conversation and break through some of the denial that we've had as it relates to addiction in the United States.
Oh, there's so many things to talk, and as soon as you say things, so many things come into my mind. But let us take a little break. Michael Botticelli is our guest, and he is the director of the White House Office of National Drug Control Policy. In the old days, they used to call it the drug czar. Michael does not like that title, and we will find out why on the other side of the break. This is America and the World. This is America and the World is brought to you by the National Education Association, the U.S.-China Education Trust, and F.Y. Chang Foundation, guided by Ambassador Julia Chang Block, President. The League of Arab States, representing 350 million people in 22 member countries. Japan, history, hospitality, and advanced technology. Sharing tomorrow. Tourism, Malaysia. The Petrolin Group, expertise with integrity in the fields of oil and gas, exploration and production, energy, and infrastructure. The Rotondaro Family Trust. The Embassy Series, uniting people through musical diplomacy, presenting international artists in diplomatic settings. And Ventana Productions, television facilities, editing, and distribution services. Michael, I was thinking about the office, the White House office, came about under President Reagan, I guess it was. They used the term the drug czar. Nancy Reagan was saying, just say no, and they call it the war on drugs. You don't particularly care for any, well, the fact that the office was established, good. But the title is unspeakable. It's unpronounceable.
I know.
And drug czar is demeaning, I think.
Well, I think, one of the reasons that I'm not particularly fond of the title drug czar, even though our office does have a coordinating function among federal agencies, which is really what the czar means, I think it has these connotations of kind of war on drug, punitive approaches, which is decidedly not part of the Obama administration's policy. We've really tried, and the president has instructed us to really look at emphasizing prevention, treatment, and recovery, that we move away from arrest and incarceration for people with substance use disorders. I think that we've seen that it's not only inhumane, but it's costly to us as a society, and it actually really doesn't do any good at getting at the root cause of the problem. So that's kind of why we've really kind of moved on a reform agenda, drug policy. So that's why I haven't been particularly fond by the drug czar, because I think that it does connote this kind of largely punitive approach to issues around substance use.
And that's changing as well, right?
And that's changing as well, and that's really reflected at the funding and our policy. So when you look at funding, of federal funding for drug control issues, the funding for prevention, treatment, and recovery is at the highest level that it's ever been in the history of our office. Supply reduction, clearly plays a key role, and law enforcement plays a key role in keeping our community safe and keeping drugs out of our community. But I think it's an acknowledgement that our policies and practices of the past have been really ineffective at dealing with some of the real-life consequences of drug use, particularly as it relates to our overuse of incarceration and arrest for people with substance use disorders.
If you had to rename the White House office, What name would you give it?
Some people have suggested I could be the recovery czar or the recovery office, which sounds much better to me. The problem, as you indicated, is the title is so damn long that people can't find an easy way to remember it.
So the recovery, and you'd like to get it back as a cabinet role, position.
Well, I think the important piece for me is, does our office have the ear of the president? Does our office have the attention of the administration? And we do.
Yeah.
Right, and we do. And so we still have the authorities that we need to retain to make sure that the president's strategy is producing results. So, for me, the important piece is, is this important as it relates to administration priorities? And it clearly is.
In the old days, it was a policeman, it was a politician, it was somebody in the military. You bring a whole different perspective to it. Tell us.
So you're right. I'm the first person with a public health background and the first person with lived experience in this. And I think it reflects kind of what the president wants, not only in terms of policy, but what he wants in terms of heading this office. I think having people with lived experience is really important to bring a real world understanding to what our office does and what our office is all about.
When you say lived experience.
So I've been fortunate, Dennis, to be in recovery almost 27 years. And that's really astounding. And as I share this journey with you, and I think what I hope to use is to show that kind of hope, the incredible opportunity that people in recovery have, that, we are vibrant participants in the community and that we have a lot to offer and that we don't have to be ashamed of who we are or the disease that we have.
Yeah.
And, one of the things that I see and hear all the time, and this is borne out in the data, is the role that shame and stigma plays.
I wanted to talk about that. And I should also put on the table for the folks watching at home that I, as well, am a recovering alcoholic of some years. And we would not be sitting on this television program, you nor I, if recovery were not in place. So that would say that no matter what it is, treatment works, huh?
Treatment works, recovery works. And I would imagine that both you and I, Dennis, would never have imagined that we would be sitting where we are today.
Well, I was thinking of church basement in Boston. Was it a Covenant?
Church of the Covenant. On Newbury
and now
Street.
in the White House. That's quite a journey, huh?
Pretty extraordinary.
Yeah.
And, I remember, kind of walking into those church basements the first few months and years. And, all I wanted was for the pain to go away. I wanted not to stop drinking and, have the creditors stop calling me. And, what I hope to show and what I think people in recovery have to show is that you have this incredible life on the other side of addiction. And, we know that shame, that stigma, that lack of hope really keeps people from seeking care. And we have an extraordinary opportunity, not just me, but the recovery community, to really show a different story to addiction.
Well, when I talk about it, I say no embarrassment, no guilt, no shame.
Yeah.
It's tough to get the hang of not drinking, but once you get the hang of it, it's not hard at all.
Yeah.
Yeah. You mentioned disease and stigma. So let's talk about those two things. Are we making progress in getting rid of the stigma associated with addiction and also the disease concept? Huh?
I think we've moved considerably over the past 10 years about our understanding of addiction as a disease. Certainly we've known that for a long time. But what I think is really exciting about doing this work is we have more and more evidence about what is effective, what's effective treatment, what it takes to get people into long-term recovery.
Michael, let me interrupt. Do we have any numbers of the number of people who are addicted and alcohol, drugs?
Sure. So it's estimated that about 23 million Americans meet diagnostic criteria for a substance use disorder.
Okay.
Right?
And how are we defining addiction?
So we define addiction by a lot of the kind of classic, diagnostic and statistical manual components of addiction. So, do you kind of use more than you planned? Do you have negative consequences in your life? So there is a whole host of criteria that you measure. We actually, here in the United States, have really good national surveys that help us really understand not only how many people might reach that criteria of having an addictive disorder, but we also know how many people need treatment. We also know how many people get treatment.
Yeah, if you got that 20 million over here, what percentage of people are getting treatment?
Well, unfortunately, still a very few, a small percentage of people who need treatment actually get it. And there are a number of reasons why, and I think this is why kind of the Affordable Care Act become really important. So we know that only about 11% of people who need treatment actually get it.
Wow.
And some of the main reasons that people cite is not having insurance and not having adequate insurance. And so the Affordable Care Act really plays a dramatic role in expanding treatment and requires a substance use disorder treatment benefit as part of the Affordable Care Act benefits. And that's huge. But we also know that stigma still plays a big role in why people don't seek care.
Like they see it as a flaw or a moral failing, or you're weak and just stop drinking, just stop using.
They see it as a moral issue. They're afraid of what their neighbors are going to think. They're afraid of what their employer is going to think. So we have a ways to go.
But if somebody had heart disease or cancer or diabetes, no question about it. People would be sympathetic. They would be supportive. They say, well, what could I do to help?
Of course. And so one of the efforts of our office is to integrate issues around substance use into mainstream medical care, right? So part of, when you think of having those diseases, diabetes, or you go to a physician.
Right.
They probably screen you on an annual basis. They will do some intervention if you are developing problems. They will ask you about your family history. They will incorporate treatment into the work that we're doing. So part of, I think, our work to really, if we want to make this understood and treated as a disease, we need to do a better job at educating physicians about addiction, about dealing with, again, screening and intervention and treatment within a whole host of medical settings. For too long, we've had two separate systems of care. We have mainstream medicine over here and addiction over here. Just last month, we actually had a meeting with all of the major medical societies and medical groups around the country, talking about increasing the competencies of the medical community to deal with addictive disorders.
Takes courage to change, though, doesn't it?
I think it takes courage to change. I think it takes evidence to really underscore what we're trying to accomplish. And again, because I think of the magnitude of the opioid epidemic, that I think it's accelerated progress. And I think people need to understand that we need to have the medical community engaged on this, that we need to have law enforcement engaged. I am really astounded by, as I talk to local law enforcement, who talk about the fact that we can't arrest our way and incarcerate our way.
They say, they're giving up their hands. They say it doesn't work.
It doesn't work. They know they have a role to play in keeping our community safe, keeping the bad guys, from operating in our communities. But they also know that they want to partner with treatment programs to get people into care and treatment.
I know your background is Massachusetts, and I think two articles that I pulled out when I was on vacation. Overdose kills kin of UMass president. The nephew of the president of UMass died of a drug overdose. But this was kind of interesting. Gloucester, Massachusetts. I don't know if you. And this was in the Providence Journal, or it might have been Boston Globe. It's an AP article. In Gloucester, the police have launched a new program where if somebody shows up, heroin or opioid addiction, and kind of turns themselves in, they will get them into treatment within 24 hours. That's an amazing change of the way police are playing a positive role.
Isn't that extraordinary? I had the opportunity to talk to the chief, who's really been extraordinary in terms of opening up his heart to dealing with part of the solution of the community problem. But he is one of many police chiefs across the country that I hear echoed back all the time of wanting to not, they know that arresting people with an addiction doesn't solve the problem.
What do you want to say to family members that obviously have someone in the house who's abusing alcohol or drugs? What do you want to say to those folks?
So what I want to say is, don't be afraid to ask for help. Don't be afraid to go to a professional, to ask about how you do intervene in this situation. Don't be ashamed. You know, I hear time and time again family members that they think there might be a problem or suspect it, but kind of they don't want to acknowledge it. And that's the worst. They know. And I think the worst thing that we can do is pretend, like other diseases. You know, the worst thing that we can do is to pretend that it's not there. So, you know, we need to have people reach out to ask for help, to seek professional assistance, because there is help out there. And there are people that are willing to help, and there's highly effective treatment for this disease.
Where does the White House office come down on medical marijuana and recreational marijuana? Where does the office come down there?
So I'll separate the two issues, because I do believe they're two separate issues. One is, and I think it's somewhat of a fair criticism, that historically the administration and the federal government hasn't done enough to support legitimate scientific research on the potential therapeutic value of the components of medical marijuana. And I say that components because even the Institute of Medicine said that smoking medicine is probably not a good delivery device for a medication. And we've stepped up our efforts as an administration to expand research, to expand the marijuana that's available for research, to diminish some of the bureaucratic hurdles that legitimate researchers went through. I think, you know, we have to make sure that science and evidence guides the way. I do have some concerns that marijuana now is being prescribed for conditions where we really don't have very good scientific evidence about whether or not it's effective. So we'll continue to pursue policies and programs that support legitimate scientific research on the potential therapeutic value of components of marijuana. On the legalization side, and I don't like saying recreational marijuana use, because I think the word recreational implies that there's not consequence to using marijuana for personal use. And we know that there is significant health harm that's attached to marijuana use, and particularly as it relates to the youth of this country. So, you know, we know that it has significantly correlated with poor academic performance. We know that about 1 in 9 people who use marijuana go on to develop a dependency and addiction to it. It's been linked to a whole host of health and social consequences. So you know, we remain opposed to legalization efforts. I think, quite honestly, it's really hard for me to justify why, you know, how we're dealing with the magnitude of the opioid addiction in the United States and simultaneously legalizing substance. I think it sends the wrong message to the youth. You know, we just released 2014 survey data. And, you know, while we've made progress in many, many areas, you know, marijuana remains stubbornly high with the youth of our country. And most disconcerting is that we see heavy use, particularly among young adults, really growing. You know, one of the things that we track is perception of risk. So we know kids, particularly if they're likely to see something as risky, they're less likely to do it. And the perception of risk of marijuana use among youth in this country is at its all-time lowest levels. And it's because of the messages that they're getting around marijuana, that it's safe, it's benign, it doesn't have consequence to its use.
I think of the 11 million kids under 12 who are living in alcoholic families right now. And one of my favorite organizations is the National Association for Children of Alcoholics. I think they just do a wonderful, wonderful job. But some of those kids coming up in those homes would be ripe for addiction later on, because some kind of a genetic predisposition, you may very well be an accident waiting to happen.
You know, I look back on my own experience. No one ever told me, because I came from a history of family with addiction in it, that I was at significant risk. No one told me that, you know, my drinking is different than other people's drinking because of that genetic predisposition. We don't do a good job at telling, particularly kids that come from families with history of addiction.
Michael, not fair, but in 45 seconds, your top 3 priorities as the director.
So my top 3 priorities are: 1, dealing with the opioid epidemic, diminishing the mortality and some of the significant consequence that we see with both prescription drug and heroin use. Continuing to promote policies that look at continuing criminal justice reform and how we move people away from a criminal justice system into care and treatment. And the third, how can we continue to promote policies and programs for people in recovery? We have, again, I think many people feel like we're at an extraordinary point in the United States to look at creating this large-scale national movement around recovery in the United States.
Michael, we are lucky to have you at the helm.
Well, and, I'm very lucky to have people like you to call attention to this issue.
Thank you. Thank you, Michael.
Thanks, Dennis.
For immediate help or more information, call this national helpline, 1-800-662-HELP, 1-800-662-4357. For information about This Is America and the World, and to watch all of our programs, visit our website, thisisamerica.net, and look for us on Facebook and Twitter. This is America and the World is brought to you by the National Education Association, the U.S.-China Education Trust, and F.Y. Chang Foundation, guided by Ambassador Julia Chang Block, President. The League of Arab States, representing 350 million people in 22 member countries. Japan, history, hospitality, and advanced technology. Sharing tomorrow. Tourism Malaysia. The Petrolin Group, expertise with integrity in the fields of oil and gas, exploration and production, energy, and infrastructure. The Rotondaro Family Trust. The Embassy Series, uniting people through musical diplomacy, presenting international artists in diplomatic settings. And Ventana Productions, television facilities, editing, and distribution services.